Hi, this is Rana Kamran Mahmood. Today we will discuss something about antifungal stewardship. If you want to reduce the cost, length of stay, return rate to the hospital, and to reduce the mortality among the patients, we should have to follow the stewardships. Antifungal stewardship is something new for the people, but it's not that much new. It started in 2010, and still now you can see in the graph that the antifungal stewardship is increasing day by day. So here we will see in 2020 there are 8 primary literature and 11 secondary literature about the antifungal stewardship, and you can see it started from 2010 and till now the people they are focusing on the stewardships. And if you will see the countries that are involved in the stewardship, you will see the maximum number of the stewardship in primary literature about antifungal is UK, and US is as well, Spain 6, and Australia as well. The other countries are also involved in that, but we have seen a lesser number of stewardship from the Asian and Middle East countries. And if we will talk about the studies which we are studying in the antifungal stewardship, the most number of the studies are the prospective and retrospective study. So if you are going to start in your hospital any sort of antifungal stewardship plan, you can follow prospective or retrospective or quasi-experimental as well. If we will talk about antifungal stewardship, there are total 59 literature is available online on the PubMed, out of which 11 are published in the antimicrobial chemotherapy journal. So the most common discipline of journal is infectious disease, that you can use it once you are going to publish your article, the original article or your study. And there are total 59 literature, out of which 36 are the primary literature and the rest are the secondary literature. If we will talk about the people who are involved in the antifungal stewardship, both pharmacists and physicians are involved in antifungal stewardship. If we will see how many pharmacists are involved, there are 15 pharmacists out of 36 as a primary author, and they run and they lead the stewardship from the front. You will see the physician, 21 out of 36 physicians in the studies, and they lead the stewardship. So both of them are very important. The other people who are very important in the stewardships are your nurses, your antimicrobial team, and your pharmacist and your doctors or physicians. They are the primary role. So if we will talk about the saving, the cost reduction, it is very clear. Averagely per year, the cost reduction of antifungals, only antifungal with the help of the stewardship, is $462,000 per annum. And the most common fungal infection which is studied is candidemia, and you will see in Candida, which is the most common Candida species, is C. albicans. So if we will talk about how they reduce the cost, how they manage the stewardship, this is some strategies. There are 23 strategies that you can find in this poster. It will help you if you are going to start your antifungal stewardship plan in your hospital. You will see these studies. The questionnaires from the doctors, nurses, and the pharmacists is very important. The guidelines, which is ESCMID, IDSA, NHSH guidelines, these are also very important. These two, the questionnaires and the guidelines from the doctors, nurses, and the pharmacists, and education as well. The testing of the sensitivity, wrap up or step down or stopping of the antifungal, as well as switch to oral, from IV to oral, and blood culture, taking your blood culture in these are the most famous 7 strategies of which we are going to use in the antifungal stewardship. The other strategies are also very important. You can use any one of them, and you can run this antifungal stewardship plan in your hospital. That will help you not only to reduce the cost, to reduce the hospital length of stay, it will decrease the mortality rate, it will reduce the return of the patient to the hospital, and this is the one of the best thing that we can use in our hospitals. So in implication, this poster is telling you clearly that the antifungal stewardship plans are running mostly in the European countries or in America, Canada, and Australia. But the lack of the studies we are finding in our Asian countries and in European and in Middle East countries. So we need to work on it, and if you will see here, especially in India, there are 2 secondary literature we have found in the India. So it's been we are expecting in Iran as well. There is 1 literature, secondary literature is there, but there is no primary literature from them. So it's been we can expect the upcoming primary literature from these countries as well. At the end, I want to tell you this poster will help you which study you can adopt, prospective or retrospective, and which type of journal you can choose to publish your articles, or which type of the journal discipline you can use, and which type of stewardship team you can select, and which type of strategies you can use. So this poster is very important if you want to start antifungal stewardship, as there is a lot of space of antifungal stewardship in our region, in Gulf region, all Middle East region. Thank you very much.